Good morning. I am Ms. Radithurai Dharmini. I am a BSc nursing student, IIHS 29 batch, OUM 29022. First of all, I like to teach about bronchial asthma. First, we are going to see introduction. Asthma is a chronic inflammatory disorder of the airway that is characterized clinically by recurrent episodes of wheezing, breathlessness, chest tightness, and cough, particularly at night or early morning. Physiologically, by widespread reversible narrowing of the bronchial airways and a marked increase in bronchial responsiveness. Now, definition. Bronchial asthma is a chronic inflammatory disease of the airways characterized by airflow obstruction, bronchial hyperactivity, and mucus production. This is a picture of normal lungs and asthmatic lungs. We can find what are the difference between both lungs. Yeah, normal lungs muscles relax, but asthmatic lungs muscles tightness. Next, lining is normal lining. Normal lungs has normal lining, but asthmatic lung has swollen lining. Finally, normal amount of mucus amount is normal, but asthmatic lungs has excess mucus. Yeah. Now we are going to see types of asthma. More types of asthmas are there, but we are see only main three types of asthma. Number one, exercise-induced asthma, which may be worse when the air is cold and dry. Next, occupational asthma, triggered by workplace irritants such as chemical fumes, gases, or dust. Third one is allergy-induced asthma, triggered by airborne substances such as pollen, mold spores, cockroach waste, or particles of skin and dried saliva shed by pets. Yeah, disease causes of bronchial asthma. There are family history, allergies, viral respiratory infections, occupational exposure, smoking, air pollution, and obesity. Next, signs and symptoms. Yeah, shortness of breathing is a more sign of bronchial asthma. Next, chest tightness or pain. Wheezing when exhaling, which is the most common asthma in children. Trouble sleeping caused by shortness of breathing, coughing, or wheezing. Coughing or wheezing attacks that are worsened by a respiratory virus such as a cold or the flu. Now, signs of an asthma emergency. Rapid worsening of shortness of breath or wheezing. No improvement even after using a quick relief inhaler. Shortness of breath when you are doing minimal physical activity. Now we are going to see risk factors. More risk factors are there. Positive family history, allergy, chronic exposure to airway irritants or allergens, having a blood relative with asthma, such as a parent or sibling, having another allergic condition such as atopic dermatitis, be overweight and smoker, exposure to exhaust fumes or other types of pollution. Final one is exposure to occupational triggers such as chemicals used in farming, hairdressing, and manufacturing. Already we studied occupational asthma. Now, triggers of bronchial asthma. Allergens, exercise, respiratory infection, nose and sinus problem, drugs and food additives, GERD, gastroesophageal disorder, emotional stress. Now we are going to how to assess the bronchial asthma patient and how to diagnose this bronchial asthmatic patient. Yeah. Occupation related to chemical and compounds. Sputum culture. Sputum culture means we can do ABST. ABST means antibiotic sensitive test. AFB, acid fast bacilli. Next, arterial blood gas analysis we call ABG. Pulse oximetry, we can see saturation and pulse rate. Pulmonary function test, PFT. Peak flow monitoring, peak expiratory flow test or PEF. Insensitive spirometer. Now we are going to see important section of bronchial asthma, that is complication of bronchial asthma. There are status asthmaticus, respiratory failure, pneumonia, atelectasis. Medical management. Quality asthma care involves not only initial diagnosis and treatment to achieve asthma control, but also long-term regular follow-up care to maintain control. Immediate intervention is necessary because the continued and progressive dyspnea leads to increased anxiety, aggravating the situation. Now we are going to see pharmacologic therapy. First, bronchodilators. Rapid relief by relaxation of airway smooth muscles. There are two main types of bronchodilators. First one is long-term bronchodilators. Other one is short-term bronchodilators. Number one, beta-2 agonist. For example, salbutamol, salmeterol. This beta-2 agonist action is smooth muscles relaxation. Next, anticholinergic agents, for example, ipratropium, tiotropium, oxytropium. Next one is methylxanthines, for example, theophylline and aminophylline. Next type of drug is controllers. Controllers action is inhibit the inflammatory process. For example, Pulmicort and Symbicort, etc. Next one is glucocorticoids. Suppress airway inflammation. For example, fluticasone, mometasone. Next one, leukotriene pathway inhibitors. This action is preventing bronchoconstriction, mucus secretion, and edema. For example, cephiricast and montelukast. Final one is chromos. Chromos action is prevent symptoms of asthma or bronchospasm. For example, gastrochrome. Now we are going to see nursing management. The immediate nursing care of the patient with asthma depends on the severity of the symptoms. The patient may be treated successfully as an outpatient if asthma symptoms are relatively mild, or he or she may require hospitalization and intensive care for acute and severe asthma. The patient and family are often frightened and anxious because of the patient's dyspnea. Thus, an important aspect of care is a calm approach. The nurse assesses the patient's respiratory status by monitoring the severity of symptoms, breath sounds, peak flow, pulse oximetry, and vital signs. The nurse obtains a history of allergic reactions to medications before administering medications and identifies the patient's current use of medications. The nurse administers medications as prescribed and monitors the patient's response to those medications. Fluids may be administered if the patient is dehydrated, and antibiotic agents may be prescribed if the patient has an underlying respiratory infection. Otherwise, no need antibiotic drugs. If the patient requires intubation because of acute respiratory failure, the nurse assists with the intubation procedure, continues close monitoring of the patient, and keeps the patient and family informed about procedure. The nurse constantly monitors the patient for first 12 to 24 hours or until status asthmaticus is under control. The nurse also assesses the patient's skin turgor to identify signs of dehydration. Fluid intake is essential to combat dehydration, to loosen secretion, and to facilitate expectoria. The patient's energy needs to be conserved and the room should be quiet and free of respiratory irritants, including flowers, tobacco smoke, perfume, or odors of cleaning agents. A non-allergic pillow should be used. Yeah. Now we are going to see our final part is conclusion. Asthma can't be cured but can be controlled with use of medications. Asthma is treated with two types of medicines. There are long-term control, quick relief medicines. Long-term control medicines help to reduce airway inflammation and prevent asthma symptoms. Quick relief or rescue medicines relieve asthma symptoms that may flare up. Initial asthma treatment will depend on severity of the disease. Patient counseling on drug therapy should concentrate on drugs used to relieve symptoms, drugs used to prevent asthma attacks, and those drugs which are given only as reverse treatment for severe attacks. Thank you.